So this will be about, like you asked, the story of how I developed diabetes and that whole thing. In 2012, I was at a point in life where I had built a clinic. I had 6 children. I was running my own clinic. I had a few other practitioners working for me. I was doing a lot of lecturing at conferences for other doctors, teaching them what things I knew. And I was also writing a book. I was working on a book that eventually ended up taking 3.5 years and being 800 pages long, called Thinking Outside the Pillbox. So I had a lot of that work stress, life stress going on, but I was at a point in my life where I was handling it all fine. It seemed like I could handle a lot. I didn't need a lot of sleep. I was going really hard. And there are a lot of high functioning, very functional people who eventually find their breaking point in one way or another. I work with these people a lot when I do LDIs because they all develop some kind of immune problem seemingly out of nowhere. But a lot of times that immunological problem, in this case, a named autoimmune disease, type 1 diabetes, for me and for many other people, it came on during a time of really intense stress. Whether it's physical stress, psychological stress, emotional stress, whatever, those are the things that bring it on, something that sets your immune system on high alert. So for me, I had 6 children. I had a busy office I was running, other practitioners working for me, doing a lot of teaching, writing this book on the weekends, getting up at like 4 a.m. on the weekends to write, and writing when I would travel. And so I really was kind of burning the candle at all ends. And also during that year, my wife at the time started to struggle with alcoholism. And that was kind of more stress adding on top of everything else. It was all together more stress than I guess I could handle. And my immune system freaked out and it decided to make me diabetic, right? Anthropomorphizing a little bit. It doesn't make decisions like that probably, but your immune system, when it gets really stressed at a breaking point, it will start to look for something to attack, ostensibly to help you out, right? And it usually focuses on some sort of microorganism that lives in your body. And most autoimmune disorders can be traced back to an immune reaction against a particular microorganism in your flora, in your ecosystem, that is normally harmless, right? It's just there, it's part of your normal flora. But when your immune system locks onto it and starts to attack it, it cross-reacts with you and your own body in some particular way, usually something very specific in many cases. So like rheumatoid arthritis, for example, is an immune reaction against Proteus, this bacterial genus that tends to grow within the urinary tract in people. And we know the molecular mimicry, the proteins in the Proteus organism that mimic your synovial fluid, synovial membrane, and cause what we call rheumatoid arthritis. But in reality, it's your immune system trying to attack this organism, right? And you get caught in the crossfire. Nobody knows as yet what the organism is that corresponds to type 1 diabetes like I have, but that's what I got. And I've spent the last 10 years actually experimenting with different antigens, trying to solve it, and have so far not come up with a strategy. And I'm going to ask for the help of anybody out there at some point to try to find the organism for me. In any case, in 2012, I finally finished the book in like September, so that was off my plate. I was still going strong in all these other areas, but towards the end of the year, I think maybe October, I started to notice that I was just mysteriously losing weight. I was about 235 pounds pretty consistently before this started. I'm about 240 sitting here right now. So it was a little lighter, but built about the same. This was 12 years ago when I was 39. And I was losing weight. It didn't really make any sense, but I otherwise thought I felt okay. My vision was getting a little blurry, but around that same time I had LASIK eye surgery, and I thought it was just the adjustment period with that. I was waking up at night with weird muscle cramps, but I did not have the classic symptoms of excessive thirst, excessive urination, and blurry vision, except I had that one, but I had an alibi, I thought. So I kept losing weight, eventually dropped down into the mid 190s. I had lost 40 pounds at this point, and I developed a sinus infection, like a bad, fever, pain in my face. I'd never had that happen before. And still waking up the night with muscle cramps. And I didn't really know what was going on with me, but doctors aren't always great at looking at themselves. People aren't always great at looking at themselves. I know that. So I went on a trip with my 3 teenage kids for Christmas time. It was like December, 17th or 18th or something. It was late in December before Christmas, the week before Christmas. So I took them to Las Vegas for a trip to go shopping and see some shows and whatnot. And when we were on the trip, the first night we were there after one of our shows, we ate gelato. And I didn't normally eat much sugar. And I think that's why it took me about 3 months to figure out what was going on with me with the weight loss and whatnot, because I didn't have the classic symptoms. I ate this bowl of gelato and then suddenly had all massive thirst you couldn't believe. I could not drink enough water to quench my thirst, and I couldn't stop going to the restroom to urinate. And my vision got so blurry, I could not even see what the performers on stage were doing at a Cirque du Soleil show. And so we left that show and I finally had this epiphany, like, oh my God, I have diabetes. Like, that's what's going on with me. I'm like, that's not possible. How could I have diabetes? I could have just come out of nowhere. And then I'm like, well, it always comes out of nowhere. So that's just what you get. That's an interesting story because that night I'm in Vegas with the only adult with my 3 teenage kids. And now I've decided I have type 1 diabetes and I've had it for months and I'm wasting away. And I could be within days or a week of death at this point, because that's sort of the end game. Before 1924, when insulin became available commercially, all of us died, 100% mortality. And that's how it would be again today if insulin went off the market. It's kind of humbling. Anyway, I went to Walgreens on our way back to the hotel room. It was late at night and the pharmacy was closed, so I couldn't get a glucometer because they kept it all behind the desk. But I got ketone test strips, which will tell you if you have ketones in your urine, and they turn purple if you have ketones in your urine, which aren't normally supposed to be there. They're there if you're starving, like people do the ketogenic diet, restricting sugar intake so low that you have to make ketones as a replacement. And it also happens in the case of type 1 diabetes, very prominent. So I went up to our room and I peed on one of the test strips and it turned dark purple, like Barney the dinosaur, just instantly. And I was like, oh shit, I have type 1 diabetes. And my kids, I was trying to tell them, they're like, are you sure? I said, well, I don't have the glucose meter, but there's no real other explanation because I've been eating all day. I'm not starving, and it's super dark. I must have type 1 diabetes. But the only other thing I could do in the room here to test and be sure is to taste my urine. And you may ask, why the hell would you need to taste your urine? Well, it's because the name diabetes mellitus, which is the name of this type of diabetes, or as old-fashioned people in the South would call sugar diabetes or something, the name means sweet urine in Latin. Diabetes means like urination. And then mellitus means sweet. So if you taste your urine and it tastes sugary, sweet, and kind of fruity, because the ketones have a fruity sort of aroma to them, then that's the other part of the diagnosis. So as my children watched, and they got a great kick out of this, I tasted some of my urine and it tasted like salty fruit punch, basically. So that was confirmation for me. Spent the night in the hotel room, wondering if I might survive or not. That night, I did a bunch of push-ups and jumping jacks, and because exercise will actually bring your blood sugar level down. Hydrated, didn't eat anything else. And then the first thing in the morning, I went down to the Walgreens pharmacy and prescribed myself some potassium pills, because that's the critical thing. That's what kills you. When you start taking insulin again, it drops your potassium levels so low that people go into cardiac arrest, which luckily I know because I've managed new diabetics in the ICU before, which is where I should have gone. I mean, if I'm following protocol, you should be in the intensive care unit. So I decided not to do that because I didn't want to ruin our Christmas trip, and I'm super stubborn. So I just got myself insulin and a glucometer, test strips, and a bunch of potassium. And I set about going back and shopping for Christmas with my kids and seeing shows and whatnot. And I managed to get myself out of diabetic ketoacidosis in about 14 hours. My ketones had disappeared from my urine. My blood sugars were stable. I kept having to take potassium pills like 5 or 6 times a day and drink coconut water all day, which is the best source of potassium you can find in a cooler that's natural. So I survived and I made it home, and that was December 2012, and now it's January 2025, and still diabetic because I'm still looking for the antigen trigger for this particular disorder. So a lot of people, when I got home, patients, I discovered that the lay public really doesn't understand the difference between type 1 diabetes and type 2 diabetes. A lot of people ask me, how did you end up diabetic? You eat such a healthy diet and you follow a healthy lifestyle. And I say, well, I don't have the lifestyle kind of diabetes. That's type 2 diabetes. I have the life isn't fair kind of diabetes, which is type 1, which hits you randomly. It's got nothing to do with your habits or your lifestyle or your diet, or how much pesticide and plastic toxicity is in you, which those are the things that cause type 2 diabetes. And type 2 diabetes is completely reversible. If anybody out there has type 2 diabetes, I can help you eliminate it. There are a number of factors. But with mine, it's the type that used to start primarily in childhood, and now we're actually seeing it with increasing frequency in adults. With mine, it's just the immune system having this one very focused reaction inside of you that attacks your pancreas in a very specific way to shut off your insulin production. So you become insulin non-existent, not just insulin deficient, but insulin non-existent. Whereas type 2 diabetics, if you measure their insulin level, they churn out shitloads of insulin. So it's really an opposite disease. Type 1 diabetes, no insulin at all. Type 2 diabetes, lots of insulin, but your body does not respond to it correctly. So that's a disease of insulin resistance, not insulin deficiency. Very different things. So I have had to live on insulin since then, since I started wearing a glucometer, the continuous glucose meters. Those things have saved my life, I think, a number of times. I nearly died, I don't know how many times from this disease. But now I'm working on a new theory in terms of the antigen that I might want to try for type 1 diabetes.